Welcome back to Talk the Walk. I'm now with Dr. Raymond Cheung, Honorary Treasurer of Medical Licentiate Society of Hong Kong. Doctor, thank you for joining us. We're talking about a medical registration amendment bill that the Legislative Council passed in October. And to quell concerns of favoritism towards non-local medical personnel, the hospital authority has said it will continue to prioritize recruitment of all suitable medical graduates from local universities and will increase promotion and training opportunities for doctors. The question is, hasn't that provided enough safeguards to reassure local healthcare workers that who may be wary of intensifying competition?
Well, I would say definitely there are competitions around. More people joining the pool, more difficulty to join our desired specialties. And we can see that in recent years, there's a certain imbalance of training opportunities in certain specialty like surgical training, which is usually a longer working hours. We have always some free space for new trainees, while for hot topics like ophthalmology, dermatology, it's quite a lot of people fighting for a very tiny space. Of course, I understand the HA would try to maximize or the need of each specialty so that we're recruiting different numbers. So I think apart from recruiting, mainly recruiting the local graduates as the first preference to avoid the local graduates to have the wariness of the possibility joining their desired specialty. At the same time, we should really consider the working environment or working scheme for each of the specialty. For example, having like good enough resting time after on-call, that we're really attracting more local graduates to pursue their own the training pathway. Having said that, having more overseas would having a competition with us, but I think at least we should defeat all the local graduates before we consider the other overseas doctor. Of course, we are not saying for the overseas doctors because you're from overseas, we're giving you a lower priority for joining us. But at least we should balance the whole system of how many interns we recruit each year and calculate the possible numbers of people willing to join the training, and then establish a better system to recruit people and a better training pathway. That would be the better way to ensure enough trainee and withholding the trainee to join the training pathway until they become the specialist. So it's not just about the numbers of people returning or working in Hong Kong, but the training program itself, how good or how to facilitate more people to join the workforce and to retain them within the training pathway and complete the training.
What else can be done to shorten the waiting time for specialists in public hospitals? And is that anything that the government can do better, or other sector like individual or corporation can contribute as well?
We are already doing some public and private collaborating work, like some CT scans or even the colonoscopy scheme. We can actually establish more collab work with the private sector so that somehow the workload or the patients can be helped a little bit by the private settings. Of course, the government or the HA should put more effort to promote the scheme or getting more support to this scheme so that they can extend the areas, not just only to a few areas, but more levels so that patients can be evenly distributed. Once the workload in the working environment becomes better, doctors would consider, okay, I'm still able to work reasonably in the public system. Then from overseas doctors, they may enjoy the wish to return to Hong Kong to serve.
I also noticed in the bill that it mentioned a special registration committee consists of local medical experts, educators, and hospital authority executives. So the committee will be established for making recommendations independently to the registrar directly on the medical qualifications to be recognized. Are there any legitimate concerns that the recommendations made by the committee will be in any way short of independence or professionalism?
I truly believe the deans or from all the different medical authority will establish their own independence idea. Definitely, there may be concern. People may say any external forces or any comments were affecting this committee. But I truly believe our professors from different university dean or different parties will definitely establish their own professional judgment to give the best advice.
Now, on the note of your optimism and confidence, I want to ask you something about the big picture. Now, we know that former president of the Hong Kong Public Doctors Association, Raymond Ma, has left Hong Kong earlier. She said that professionalism is dwarfed by political considerations in the making of decisions related to public health in today's Hong Kong. A few months ago, Hospital Authority Chairman Henry Fan also expressed worries that the manpower shortage in public hospitals is exacerbated by immigration. Now, first of all, is it really fair to oppose the introduction of non-locally trained doctors, while local public doctors, many of the middle-level specialists, either switch to private sector, as you mentioned, or move to other countries, leaving the ordinary citizens to suffer from the consequences of worsened inequality?
This is pretty complex questions.
Yeah, of course. You're the right person to ask the complex questions of.
I do have to break it down bit by bit. Yes, definitely I've seen quite some specialists doctor moving out from the public system to the private sector. Very likely, from what I know, they're quite probably in general Hong Kong environment, and also they're considering their workload within the HA. I would say it's no only solely one reason making lots of people moving out. I think it's quite complex, like a family concern, their kids, their future, their kids, whether they're educating Hong Kong or somewhere else, or they desire to stay in the public system because of the long working hours, or rather they would like to enjoy more self-free time in the private sector, or even the concern whether they would like to migrate to other countries due to the recent conflict within the society. I think it's quite a combination of all of this. I wouldn't say we have got much pressures from having voices of the new Ordinance Amendment. Otherwise, I wouldn't be here talking with you. I think it just mattered how we share our ideas rather than we are just talking with some reasonable concerns, or we're just doing something else. I think I wouldn't say that the pressures is here, forcing us not to speak. We're still allowed to talk, to share the ideas. While the doctors moving out from the public system, I think it's quite mainly about how the working environment and the public system comparing with the private system. The loadings making many of the doctors feel so exhausted. Probably once they gain enough experience with the public system, they would consider to choose in private systems because they have more time to join with family, maybe even better income earning to support their own family as well. So I think it's quite kind of combinations of many different factors. So not solely about the politics, but some other factors contributing as well.
Yeah. Now, Raymond, you're the Honorary Treasurer, one of the leaders of a medical group. I was wondering, following the deregistration of the General Union of Hong Kong Speech Therapists, it seems that politics have seeped into more and more aspects of the society, including in public health. Are you confident that the paramountcy of Hong Kong's medical standards is able to prevail against the political noise?
I would say right now, it's a bit tight moment to speak whether there's political pressures to us. The whole society has been changed dramatically in the last 2 years. But I think at this moment, the medical professionals are still enjoying a very high level of autonomy, independency. We're still able to make our own professional judgment or decision for the best of the benefit of patients with any of the political pressures. This is why I like working in Hong Kong. We're still enjoying a good support from our seniors, from our doctors, the whole community, the doctor professional community are still working quite well. Although we may worry about the future, but at least at this moment, we are still doing quite well, haven't got much concerns or forces from any areas outside the medical professionals.
Okay.
Well, us to provide the best care for our patients.
All right. Well, that seems like a good place to wrap up our interview today. Thank you very much, Dr. Cheung, for your time. Dr. Watt will be back next week. Stay tuned.